Hello and welcome. My name is Dr. Matui Kavita. I'm a consultant gynecologist, obstetrician gynecologist at Gynecologist Hospital. I want to talk to my patients, the ones who are just about to give birth, about how to give birth, basically childbirth. I like to call it pre-delivery counseling. Let me title it. Very legible and written. Pre-delivery counseling. So this is for mothers we are preparing them psychologically about the process of labor. One, definition. What is labor? Labor is one, lower abdominal pains, which have three characteristics. One, lower abdominal pains, they go to the back, commonly called radiate to the back. Then they increase in frequency. Frequency means that they're getting closer and closer. Then they also increase in intensity. Intensity is the degree of pain. It starts slower, lower, then keeps on increasing. That's number one. Number two, mechanism of labor. What actually really happens during labor for a baby to come out? Normally before a baby is born, the cervix, which is the opening of the uterus, is closed. So we say it's 0 centimeters closed. And once during the process of labor, the cervix to slowly dilate from 0 centimeters to 10 centimeters. So labor is divided into two phases, just generally, patient's language. 0 to about 4 centimeters is called latent phase. Latent phase is very slow. Slow phase, it take 18 to 24 hours. Actually, labor many times when it starts, ladies aren't even able to perceive it till later on. Then from 4 to 10 centimeters, this one is commonly called active phase of labor. Active phase of labor varies. The progress in women can take about 0.5 centimeters to about 1 centimeter per hour. So this from 4 to 6 to 10 centimeters, 10 centimeters is 6 centimeters. So if you are progressing slowly, okay, about 0.5 centimeters per hour, it will be about 12 hours. If you're a fast progressor, especially if you've given birth before, it's about 6. So it's 6 to 12 centimeters. This is not cast on stone, it varies for different ladies. Before we get number 3, from 10 centimeters, it's normally called second stage of labor. This is when the baby normally comes. It's important to say that from the latent phase to the first stage, usually it's a natural process. Usually there's no effort required, physiological process. Okay, the mother doesn't need to do anything. From second stage is when usually the midwife, gynecologist, we give instructions to the lady on what to do for the baby to come out. All right, when to come to hospital? When to come to hospital, Gynecologist Hospital. I like to say there are 7 reasons which commonly would make you come to hospital. 1, labor. As you said it, there are 3 characteristics: low abdominal pain with back radiation, increasing intensity, frequency, and so that one. Usually labor is not extremely dramatic. From the onset of it, you have about 3 to 4 hours to get ready. It's not labor comes now, the baby comes out. So you still have time. 2, when to come to hospital? Basically danger signs. What should bring you to hospital? Bleeding. The only time you should see blood really is after baby is born. Anytime you see bleeding before, even during pregnancy, please come to hospital. It's an emergency sign. 3, when you see mucus plus some blood stains, this one in medical terms we call it show. Usually means you're in advanced labor about 4 to 5 centimeters, because this is the plug which covers the cervix. So if it is getting out, it means that you're already dilated. Please come to hospital. When to come to hospital? Liquor, drainage of liquor, that's amniotic fluid. Okay, drainage of liquor, you see amniotic fluid, usually very dramatic, it's a gush. If you're sitting, you might think that you peed on yourself. If you're walking, just drips down to the thighs and on the floor. You need to come to hospital. This one is also an emergency, you need to come to hospital. Number 5, normally something called severe headache. Severe headache could have many reasons, but for pregnant women, we tend to, many times it could actually be elevated. Blood pressure could get higher, and blood pressure can be very normal during pregnancy, only for it to shoot. So severe frontal headache mainly, please come to hospital. Number 5 is due date. Your date, specially calculated by Britain, call it EDD, calculated from the last periods. Sometimes you're not too sure by early scan. Usually, when it gets there, please pack as what you need to come to deliver, and come to hospital. You'll be told about induction and a later sitting. 7, what have I forgotten? All right, yeah, all these concern the mother. There's one which concerns the baby. Reduced movements. Please don't come to me when the baby has stopped playing. I want, if there's a way a baby communicates to the mother, if these movements reduce, please do not wait, come to hospital. A baby playing less could mean that could be trouble. All right.